Well, welcome back at 7:14. Women face diverse and unique health concerns across the lifespan, which may affect their overall health and wellness. Also known as a yearly physical, all women should have an annual women's wellness exam. Knowing the diseases and conditions that are among the top health risks for women is important to effectively manage your health. With us this morning is Touro OBGYN, Dr. Vibha Rao, here to talk about some of the health issues that women are facing and reminding women to get those screenings. We're still fairly in the new year, still somewhat the new year, even though we're at the end of February. A great reminder to get those appointments scheduled. Let's talk about the ones that everyone knows about, getting the annual your OBGYN exam. Talk about that exam and what it should entail.
Yeah, so obviously it's a pretty comprehensive health exam. For women that I've seen before, it's pretty run-of-the-mill, straightforward, because I already have kind of a baseline of what screening exams they've already completed. But if somebody new is coming to me to establish care, I often, most of these screening exams are age-based, right? So mammograms, we do that 40 and up. Colonoscopies, we talk about 45 and up. Bone density scans to make sure that your bones are strong and healthy is 65 and up. And then of course our run-of-the-mill pap smear and pelvic exam. And for the pap smears, we do that starting at age 21 and go upward. There's obviously different age-based guidelines for that as well, in conjunction with human papillomavirus or HPV testing.
And that's what I wanted to kind of stop on that topic right there. I know typically in the past, let's say 10 years ago, every year a woman would go to her OBGYN and get a pap smear every single year. But the guidelines have changed. You don't have to get that screening every year, even though, like I told you, I'm all for just, if I'm here, do the screening, but you don't have to get that every single year.
No, you don't have to get that every single year. Under the age of 25, we really only do it every 3 years, and then you don't actually test for HPV, or you don't have to test for HPV. It just depends on what the results are. And then over 30, we do every 5 years if they're normal, and that's co-testing. So that means you test for cervical cells that are abnormal, but you also test for HPV.
And that's also because of, you said, the slow growth of cervical cancer cells, typically?
So you'll often see like interval changes if you have the HPV virus, and that's what's affecting the cells of the cervix.
And let's talk more about breast cancer exams. As you said, 40 and up unless.
So 40 and up for mammograms specifically. I still do breast exams on everyone. And I know the guidelines for self-breast exams are also changing. But I always tell my ladies that you know your body best. So if you feel any lumps, bumps, bruises, lesions, anything that's abnormal to you, you bring that up to me. And there's something we can always do about it. Mammograms, the general screening, if you have no family history or no personal history of abnormal breast tissue, we say 40 years old and up. Otherwise, guidelines change based on if you have a family history of cancer or if you have a personal history.
And that's every year, whatever category you fall into for the mammogram. Okay, let's talk bone density exam. How does that test go exactly?
Yeah, so it's called a DEXA scan, and it's a full body scan where they look at specific bones, and there's like an algorithm associated with it, but basically it provides you with a number, and that number gives you a diagnosis of osteopenia or bone, like weak bone, osteoporosis, which increases your risk of fracture, and then or normal. And we do that at the age of 65 because that's based on the guidelines.
And doctor, I know we are on February 21st, but in this region, we are kind of really just starting the year post-holidays. So again, a great time to make those appointments with your doctors and have those conversations about if you need any of those screenings you just mentioned.
Absolutely, and it's not just about screenings, but also overall health, right? So good diet, good exercise, mental health, vaccines, all of the things can happen at these annual visits. So.
Well, Dr. Rao, thank you so much for your time. A good reminder, again, we're still pretty much in the new year, everyone, so let's get those doctor's appointments scheduled.